Alright, so first I would start with some hand hygiene, and then I'll start with the questions. So, hi, my name is Amanda. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Julia Michaels, 2/21/1950.
Alright, and can you tell me why you came to visit today?
I'm here for a follow-up visit after my kidney transplant, but I've also been experiencing a lot of UTIs as well as ear pain and headaches.
Okay, and can you tell me where you are right now?
UCMC,
And what is the date today?
November 23rd, 2020.
Alright, perfect. It looks like you are alert and oriented ×4. So now we're going to go ahead and I'm just going to ask you a couple of questions. So we'll start with your head. Can you tell me if you've been experiencing any frequent dizziness or headaches?
Yes, frequent headaches, but occasional dizziness.
Okay, and when does the dizziness occur?
Usually when I'm changing positions quickly, especially when my blood sugar is low.
Okay, and then regarding the headache, what is the character of your pain? Is it throbbing, sharp?
The pain feels like my head is being filled with pressure, like it's being blown up like a balloon.
And when did this pain begin?
These type of headaches are pretty common for me, but they have been getting worse the past couple of months.
Alright, and can you explain to me the exact location of the headaches?
It's all around my head, from my forehead to my temples to the back of my head.
Okay, and is the pain constant or intermittent?
The pain usually comes and goes every couple of hours.
Okay, and on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain ever, can you rate your pain?
Probably a 3 out of 10 at the least and a 6 out of 10 at the worst.
And is there anything that makes your pain better or worse?
Resting and drinking water does help, and when my blood sugar is normal, they usually don't occur. But moving my head a lot makes it worse.
Okay, and is there any associated symptoms such as nausea or vomiting?
Sometimes it makes me tired, but that's it.
Okay, and then do you take any medications for this pain?
Yes, I take Excedrin whenever the headache gets too bad.
Alright, and then do you have any abnormal bumps or lesions on your head?
Not that I've noticed.
And do you partake in smoking?
No.
And are you exposed to any frequent secondhand smoke?
No.
Alright, so now we're going to move on to your eyes. And can you tell me if you've been experiencing any changes in your vision, such as dark spots, blurriness, or floaters?
Yes, I've been experiencing floaters, blurriness, and dark areas of vision.
Alright, and have you had any eye pain, redness, watering, or discharge?
Yes, my eyes are frequently watery and red, but that's not a new occurrence.
Okay, and then do you have a history of glaucoma?
No.
And have you had any surgeries on your eyes? Do you take medication or use corrective lenses?
No.
Alright, and I think that's it for your eyes. So we're gonna, actually one last question. When was your last eye exam?
About a year ago.
Alright, and we're gonna move on to your ears. Can you tell me if you've had any recent hearing changes or ear pain?
Yeah, I have not had any recent hearing loss, but I do have pain in my right ear.
Okay, and regarding this pain, what is the character? Is it sharp, throbbing?
It's a deep throbbing pain, but there's also an itchy feeling.
And when did this pain begin?
I get these ear infections every so often, but this one began about 3 days ago.
Okay, and is the pain located inside your ear or near the outer portion of your ear?
It's deep in my ear.
Alright, and is this constant or does it come and go?
The pain is always constant, but it's mild, but more severe pain comes and goes throughout the day.
Alright, and on a scale from 0 to 10, 0 being no pain and 10 being the worst pain ever, can you rate your pain?
Probably a 2 constantly, and then around a 4 when it gets more severe.
Alright, and is there anything that makes this pain better or worse?
It gets worse when I lay down or move my head a lot.
Alright, and is there any associated sore throat, changes in your gums or teeth, or mouth area, or discharge?
Sometimes there's like a drainage that smells weird, and I get a fever sometimes, and it also can itch.
Okay, and what do you use to clean your ears? Do you use Q-tips or anything like that?
No, I normally just use a tissue.
Okay, and then have you been experiencing any crackling, any ringing, or anything like that in your ears?
No, not that I can remember.
Okay, perfect. Alright, so now that we've got that done, I'm going to go ahead and start doing some tests. But first, before I start that, I'm going to note that your speech was fluent and consistent, your mood and affect were pleasant, and your level of consciousness was intact. So first, I would start by taking her vital signs, and I would do temperature, then I would do pulse, respirations, and blood pressure. And then I'm going to go ahead and start by checking your eyes. So I'm going to start by checking your pupillary and consensual reflexes. And I'm going to shine a light in your eye. I'm going to have you look straight forward at me. And then I will check. Alright. Alright, looks like your pupillary and consensual reflexes are intact. And then I'm going to check your extraocular eye muscles. And I'm going to have you keep your head looking straight forward. And then I'm going to move this pen and you're going to follow it with just your eyes. Alright, looks perfect. And then if I was in a hospital setting, I would check her visual acuity with the Snellen test, especially because she expressed that she was experiencing some blurriness. Next, I'm going to go ahead and check your ears. And normally I would use an otoscope, but I don't have that right now. So I'm going to have you look that direction. Alright. And then look that direction. Alright, so it looks like you do have some yellow drainage in there and a little bit of buildup of earwax. Next, I'm going to have you smile really big for me. Perfect. It looks like your facial symmetry is intact. I'm going to have you say, ah. And normally I would use a tongue blade for that if I had one. And it looks like that is looking good. Your mucous membranes are intact, and there's nothing wrong in there. Next, I'm going to check your upper and lower extremities for moisture, color, temperature. So I'm going to just palpate a little bit. And flip. Alright, I'm going to check the other. And it looks like your moisture and temperature are looking great. Your skin is a little dry and scaly. Now I'm going to check your nail beds. And it looks like your nail beds are slightly wider than normal. But your capillary refill is also a little slow, approximately 3 seconds. I'm going to check your lower extremities. So normally I would lift up her pant leg so that I could assess temperature and color. And it looks like this is consistent with your upper extremities. Your temperature and color are appropriate, but you do have a little bit of dryness and scaliness. Your nail beds are slightly white, and your capillary refill is approximately 3 seconds. So I checked all of that bilaterally. And next I'm going to go into your checking your carotid. So first I'm going to palpate and just check both sides individually. And I'm going to go ahead and auscultate. Bilaterally. And while I was doing that, I did have her hold her breath, and it sounded great. There were no signs of bruise, and everything seemed normal. Next, I'm going to go ahead and check your heart sounds. So I'm just going to have you breathe normally while I do this. And I'm going to start with your aortic, going to go to your pulmonic, your Erb's point, tricuspid, and mitral. And everything sounded great. I'm going to go in to check your apical and your radial pulse. So I would assess this for a full minute if we were in a hospital setting. And after that full minute, I found that the apical pulse sounded great. There were no signs of clicks or murmurs or bruise while checking the heart. And now I'm going to compare it to your radial pulse. Can I see your hand from you? And then while I was doing this, I would tell the patient that I'm checking the radial pulse for a full minute, but I'd actually just be checking it for 30 seconds, doubling it, and then for the second 30 seconds, I will be checking her respirations. So I'm just going to get this going. It looks like it was 82, and for the second 30 seconds I will be checking her respirations. respirations were 18. And after that, I'm going to go ahead and check her breath sounds. So I'm going to start posteriorly. All right, and I'm going to start on her left side. I'm going to have you take a deep breath with every placement of my stethoscope. Alright, sounded great, and now I'm going to check your lateral breath sounds. So I'm going to have you stick your arms up, and I'm going to start with your right side. Take a deep breath. Alright, perfect. And now I'm going to check your anterior breath sounds. So again, I'm going to have you take a deep breath with every placement. And I'm going to start on your right side. And I'm going to have you just put your arms down to your side. Alright. Alright, everything sounded great. There were no signs of adventitious breath sounds. So next I'm going to go into checking your abdomen. So I'm just going to have you lay down for me. And normally I would have her raise her shirt so I could inspect her abdomen, but I'm just going to note that there's no signs of distension or abnormality. And next I'm going to go into auscultating each quadrant. And I would listen for a full minute in each quadrant. Alright, it sounded great. Her bowel sounds were normal active. And next I'm going to go into auscultating. And I'm just going to have you note if you are experiencing any pain. Did you feel any pain?
No.
Perfect. All right, I'm gonna have you sit up. And next, I'm gonna go into your peripheral pulses. So I did check your radial pulse before, and it seemed great. It was consistent with your apical pulse. So I'm just gonna check your other radial pulse. So I would do that for 30 seconds. I'm gonna go ahead and check your lower extremities. So I'm gonna check the dorsalis pedis and the anterior tibial, and I would do both of those for 30 seconds and check that bilaterally. And then next I'm going to go and check your edema. So while I was checking for temperature and color and moisture in her upper and lower extremities, I also noted that there were no signs of edema in her upper extremities, but her lower extremities did have some slight edema. And we're going to go into range of motion now. So I'm just going to have you follow my movements. So we're just going to start with putting your arms up and down, and we're going to cross them in front of you. I'm going to have you shrug your shoulders, and then put your hands behind your head and behind. And then if you will put your arms in front of you, bend them, straighten them, put palms to the floor, bring them up to the sky. All right, and then turn your hands in and then out. All right, and I'm going to check your head. So I'm going to have you tilt it forward, and then backwards, and side, and then look to your left and look to your right. And now I'm going to have you stand up for me. I'm going to have you turn to the side and just lean forward and come up and lean back. Perfect. You can take a seat. I'm going to just have you lay down for me. All right, and I'm going to have you bring your knee to your chest, and then do that with the other side. And then I'm going to have you bend your left knee and bring it out to the side, perfect, and inward, and then stick it out and put it up in the air, perfect, and then can I have you bring your right knee up, bring it inward and outward, straighten your leg, bring it up to the sky, perfect, and then I'll have you bring it out to the side, and your other leg, perfect, and I'll have you stand up for me. And we checked all of those bilaterally. And then I'm going to have you just move your ankles, bring your toes to your shins, and then have them point to the ground, and bring them inward and outward. Perfect. Now I'm going to check your strength. So I'm going to have you put your arms like this in front of you, and push against me, pull forward, and now push against me. All right, and then I'll have you stick your arms straight out in front of you, and push up, and push down. Perfect. I'm going to have you shrug your shoulders. Perfect. And then push against my hand and backwards. Perfect. And sideways. Awesome. And then I'm just going to have you push against my hand here. And there we go. And now bilaterally. And then I'm going to take push against my hand here. There we go. Plantar flex, dorsiflex, and plantar flex. And then I'm going to also just have you, there we go, and open your hands. I'm actually going to have you squeeze my finger. Perfect. And then that is it for strength. I'm going to check your gait. So I'm going to have you stand up for me and take 5 steps forward and then come on back. Perfect. It looks like your gait is even and steady. And I'm going to check your balance by doing the Romberg test. So I'm going to have you look straight forward, close your eyes, and have your feet together. And I'm just going to count to 20, and I'm going to check for any swaying or wobbling. And it looks like you have a negative Romberg test, which is awesome. And we are all done for today. So thank you so much.
Thank you.